And welcome back to WMTW News 8's Commitment 2016 Question 1 Marijuana Debate. I'm Paul Merrill here, joined by Alicia Melnick from the yes side and Scott Gagne from the no side. A pleasure to be talking with you guys. Thank you for being here. Before we talk about the health issues, we're going to shift to another story that we did out in Colorado on how the legalization of recreational marijuana is creating some health concerns.
Very good.
Recreational marijuana has been legal in Colorado for almost 3 years now.
And hospital policy.
Public health officials question people who say the sky didn't fall.
I would say by whose standards did the sky not fall? And it's really important, especially with marijuana, to consider how long it takes the sky to fall.
Ben Court is an administrator at CEDAR, the Center for Dependency, Addiction, and Rehabilitation at the University of Colorado Hospital in Aurora.
There's a lot more happening out here than what the headlines say.
For years, Colorado has been above the national average when it comes to marijuana use. State data show teen use has been flat since legalization, but Court points to national data showing that the Centennial State is #1 in marijuana consumption across every age group. A big difference between what's happened here in Colorado and what could happen in Maine has to do with amount. Here in Colorado, you're only allowed to buy, and I'm only allowed to physically hold 1 ounce of marijuana. Now, if this ballot question passes in Maine in November, it means adults will be able to buy 2.5 times that, 2.5 ounces of pot. Public health officials also warn of the increasing potency of cannabis products. This is not Woodstock weed.
I can't hit all that.
Naturally occurring inside of cannabis is between 0.2 and 0.5% THC. We're talking about THC above 40% and then above 90% with concentrates. That's not natural, and it's not good for the brain and body.
That's raising a lot of questions for the doctors who work with Court at CEDAR. Dr. Michael Barnes is the clinical program manager.
It's like a big science experiment. We don't know what's going to happen with long-term, very high levels of THC use.
Dr. Barnes says pot has always been a significant part of the drug catalog among his younger patients, but lately he says he's been seeing more and more patients with psychotic symptoms, raising this question.
Is this a thought disorder or is this a drug-induced psychosis?
Very high potency.
Dr. Laura Martin is an addiction psychiatrist and CEDAR's medical director.
I think that the jury's still out for the lessons that we have, and we certainly don't have the lessons that we're going to learn in 10 years related to the number of individuals who may develop other drug use disorders because they're using marijuana now.
While some people argue that the availability of legal cannabis means fewer people will turn to harder drugs like opioids, the people at CEDAR say marijuana is a gateway drug to more serious substances.
Not everybody is thinking about the long game with this.
Court says the problem with trying to get his message out there is that there's no money in prevention, and people would rather listen to celebrities than public health officials.
Willie Nelson has a different message than I do.
Some Emerald OG and some Black.
All right, so let's begin this discussion about health by talking about the potency issue. You know, as you heard, this is not Woodstock weed. This is one of the things that surprised me during this reporting is this is not what people were smoking even just 10, 20 years ago. Colorado has not capped the THC potency. In Maine, potency limit, if this passes, will be set by the Department of Agriculture during a rulemaking process. But if it does pass, Mainers will be able to have 2.5 times what Coloradans can buy right now. So, Alicia, I'm going to start with you.
Sure.
Potency-wise, amount-wise, is this safe?
Sure. I think, we need to just understand that part of what the opposition starts with is sort of a fallacy that this would bring marijuana to Maine or introduce marijuana to our communities. I think, again, we have to acknowledge that marijuana is here in Maine. It's being used from the black market and it's being used from the medical market. And what this would do is bring it again off the street corner behind the counters of regulated taxed businesses that do test for things like safety and potency. Just with like the beer law that was changed last year, for consumers to have more information about the potency and the safety of their products is a really good thing. And it allows them to make better decisions about what they use and how much and when they use it. Governor Hickenlooper from Colorado, who initially opposed this law, said about the same people are using it now as were using it before. They're just paying taxes on it. And I would say, and they're also getting more information about the potency and safety of it. So this is a good thing.
Before we go to Scott, can I push back a little, because what we heard from some of the public health officials is that the big business aspect of this helps them fund the development of making these, these dabs that are 90% THC. I mean, is 90% THC potency something that exists in Maine right now, or do you need that business element to get to that extreme level of potency?
I'm sure that strong potency, that all the sorts of things that exist in the market in Colorado exist in the market in Maine right now. Again, this would just take that industry and that market and bring it out of the darkness and into the light, where we can have a better understanding of it, we can test it for safety and potency, and we can get taxes paid on it.
Scott?
So I think the potency is a huge issue, and I think we need to, again, correct the record here. In Colorado, not only did they add the commercial market, they still have the black market, and the black market is actually growing right now because there's a black market growing to ship Colorado weed outside of the state. And so it's exactly what we'd see here in Maine. We would become the weed basket for New England, the illegal weed basket for New England. The potency is a real issue. We don't have shops right now that are selling 90% THC on Main Street. This is what question one would bring. It would bring these potent edibles, gummy bears, where even half a gummy bear is an adult dose of THC. To think of our young people getting a hold of these. To think of our educators, how can they keep these from coming in their schools? What we know is in the state of Washington, they can't. There's one school in Washington where before legalization, they had one drawer to keep confiscated edibles. Now they're using 3 large closets to store everything that's coming into their schools. Educators would need training. And even then, to think that they would be able to spot a bag of THC gummy bears in a crowded cafeteria, it's just not going to happen. This is going to be really bad news for our youth.
The next question is about edibles, but go ahead.
I just have to push back on that. Again,
Yeah.
Colorado just passed regulations that ban anything that would confuse kids or attract kids. That's specifically provided for in the law. That's something that we can do there. That's common sense. That's not incredible. Again, it's not like pot brownies haven't been around for decades, and yet we're able to be responsible adults in terms of keeping all kinds of things away from our kids that would be potentially harmful for them. This is not about a law that's going to intend to push things on kids that are going to be confusing to them or appealing to them. This is about adult use. This is about responsible adult use, and about regulating and taxing the responsible adult use that's already occurring in Maine.
That goes right into the next question we had about edibles. There were those issues you talked about with people not knowing what they had, and then they made those changes. I believe it was in October of this year.
That's right.
That made it so that all the edibles needed clear markings on the edibles themselves, and also specific packaging, both individualized packaging and packaging that would prevent children from ingesting pot. I wanted to ask you this first, Alicia. I mean, would that be done through the rulemaking process here, or should that already be in place so we don't have the same problems where kids are eating something that they don't know what's in it, or an adult is eating something that they don't know what's in it?
Yeah, I think the provision to have it be done through rulemaking is that it can be done with a thoughtful, transparent process that makes sure that we take everything into consideration, both in terms of what we know now and what we can learn from other states. Banning things that would be confusing or appealing to gummy bears is absolutely something that is part of what that intention is. Also, bans on marketing to youth. Again, the idea that we're going to have shops on Main Street with giant gummy bears, with pictures of kids eating lollipops, is just not the reality. This is about taking it into responsible adult use in ways that, again, can have child-proof packaging, opaque packaging, testing for safety and potency. These are all really strong, good regulations, both for the consumers themselves and for any children that might be around them.
Scott,
Except nothing that she just mentioned is in question one. There's nothing in there that says edibles are banned. There's nothing in there that says there's any regulations around packaging. It goes to rulemaking. And what happens in rulemaking is the hearing room will be packed with lobbyists from the marijuana industry, which is what's happening in Colorado and Washington right now. And they will water it down. So that they can say now that we're going to have, they can try to promise these things now, but it won't be reality. And so we will have gummy bears, we will have lollipops, we will have sodas, and they still have those in Colorado. They have not banned edibles. They made some weak changes.
They're marking them.
So there's still gummies that you can get. It may not be in a gummy bear, but it's still going to be attractive to kids. They're already using the big tobacco playbook, and they will here in Maine.
I want to get to opioids. Alicia, you want 10 seconds? Should this have been in the question one language?
It explicitly says that the rulemaking will do things like bans on marketing to children. So again, I think that's a little bit disingenuous to say that this isn't going to happen.
Well,
no one that supports this bill wants this to get to kids. This is about adult use and about a responsible adult use. I'm a mom of 2 young kids. Nobody that supports this campaign is pushing for marijuana to be given to children. That's why it says 21 and over. you
But they
know,
have
over and over again in this law. This is about adult use, and all of this is a distraction because, again, there's no reliable, good argument about why we should continue to criminalize responsible adult use of marijuana that's already occurring
Again,
and has been occurring in Maine for decades.
The
very
rulemaking will
quickly.
go to the hands of the legislature. They can't do anything about what the legislature decides.
Okay.
I mean, they can say that that's their intent, but it's up to the legislature. And again, they'll pack the room with lobbyists, just as they do now with the medical marijuana bills, loosening the medical marijuana bills. So it's they can't. It's not a promise they can't deliver on.
I do want to get to opioids. That's our next topic, and it's certainly extremely relevant in Maine with the opioid epidemic here. Colorado dealing with a similar problem as far as people overdosing and dying on things like heroin. We asked the state's top health official how marijuana factors into this discussion, and take a listen to what he told us.
So there's two schools of thought. One is marijuana is a gateway drug. So if you legalize marijuana, more people use marijuana, more people are going to use opiates. The second school of thought is if I can have marijuana legally, then I'm less likely to need prescriptive opiates, heroin, because I can use something that's less addictive, arguably less toxic than these other illicit substances.
And he went on to say that there's not enough data for him or the health department to come down on either side of the issue, but I want to ask you two, I think I know where you're going to fall in the opposing viewpoints here. Scott, let's begin with you.
Right. So, I mean, I'm not going to sit here and tell you that marijuana is the gateway drug, but it certainly is an entryway to addiction. We know this. The data shows it. What we know is someone with a marijuana addiction is at 3 times the risk of developing a heroin addiction. I mean, that's just what the data shows. We know that with addictions, 90% of our addictions start in youth, and we know that 1 in 6 will develop a marijuana addiction. So to me, it seems pretty clear that this is the last thing we need while we're dealing with an addiction crisis. This is like you're bailing out the boat and now you're going to drill a hole in another end of the boat. That doesn't make any sense. So it's not that everyone who uses marijuana is going to develop a heroin addiction. We're not saying that. But when you talk to anyone in Maine that works with young people who develop addictions, I mean, day one of our supporters, they'll tell you most of the clients that they deal with, they started with marijuana. So it's not everyone, but it is a very common occurrence.
Do you know off the top of your head that 3 times more likely stat? I've heard that before. Do you know where that's from?
That's from the National Survey on Drug Use and Health. And by the way, for alcohol, it's 2 times. So it's actually a marijuana addiction puts you at a higher risk of developing a heroin addiction compared to alcohol.
Alicia, do we need to legalize another quote-unquote drug with the opioids issue that we're dealing with?
So here's what we know, right? We know that we're facing a really serious opioid crisis in Maine that we should be doing everything we can to address. We also know that the vast majority of people that have an opioid addiction started with a prescription painkiller that was prescribed under the supervision of a medical professional. That has been the start of the problem. We also know from the World Health Organization and other very reliable sources that the only way that marijuana is a gateway is because people are buying it on the black market from dealers who have a high incentive to push and sell highly addictive, highly dangerous drugs like opioids. What we also know from the Journal of Pain and Columbia University is that for people who use marijuana to treat pain or to treat their addiction, they have a much less chance of getting addicted, and they have a much greater chance of finishing their treatment for addiction. So we've talked to patients over and over again, including veterans and others who got addicted to Vicodin and other serious painkillers, who have used marijuana instead of these painkillers to both treat their pain, their PTSD, their anxiety, and their addiction itself. It alleviates the pain and the suffering of the withdrawal and the nausea of withdrawal, and allows people to use these other drugs, use this instead of the prescription drugs that they're becoming dependent on.
Now, the state rulemaking earlier this year just did say that they will not allow medical marijuana use for opioid addiction treatment.
They did. Yet, which is interesting because it's very acknowledged that marijuana is an acceptable treatment for example, the nausea associated with chemotherapy and radiation. So the idea that it wouldn't be effective treating someone's nausea related to opioid withdrawal doesn't really make a lot of sense. And again, we hear stories again and again from people who have gotten their lives back because they're of marijuana.
I want to move on because the medical marijuana community is certainly concerned that any recreational legalization is going to have some serious changes. So, Scott, we'll start with you on that one. Would passing question 1 have a negative impact on the medical marijuana growers and
I think absolutely.
caregivers?
I think absolutely. I mean,
How so?
the way it's structured, there's not going to be, right now we have over 3,000 medical marijuana caregivers in the state. There's not going to be enough licenses for all of them to deal with that. And while we can look at the other states that have legalized, like Washington State, and what they did in Washington, what they're doing in Washington right now is they're shutting down the medical marijuana program and folding it under the recreational program.
But it's working they're working simultaneously in Colorado.
Yes.
To some
Yes,
extent,
no?
but there is
Okay.
an active, they are actively trying to shepherd patients into the recreational because of the tax difference. I mean, I think the other thing we have to think of around medical marijuana as well is, there's relationships that are developed between a caregiver and a patient. I mean, they're trying to treat, they're trying to deal with someone that they can trust. And the idea that we need to pass question 1 to open up the floodgates so anyone can just go to a shop, self-diagnose with whatever, and get marijuana, that's going to circumvent that relationship.
I want to turn to
which is a
Alicia
big
on this.
problem.
We're running out of time.
Sure, we agree that I mean, I was instrumental in drafting LD 1296, which helped create the structure that we have right now. We really think that the relationships between caregivers and patients, or dispensary operators and patients, are valuable. That's why this law explicitly is separate from the medical program. It protects the medical program. The licensing in this program is not intended to encompass those 3,000 caregivers. It's intentionally separate because, again, we believe that we know that the medical program is working well for the patients who are able to access it, and that should remain intact. However, there are many, many patients throughout the state for a variety of reasons, even if they have a qualifying condition, who can't access medical marijuana. They can't afford or access a doctor's recommendation. Many doctors are prohibited from providing a recommendation by their health system or by the fact that they're a federally qualified health center. And even patients who have cancer that I know personally have not been able to access a recommendation. So this would be good for patients while protecting the structure and the ability of the current caregivers and their patients to continue business as usual.
I just
We
want
need to break.
just,
Go ahead. Yep.
Just quickly, I think a majority of medical marijuana caregivers and patients would disagree. In fact, we have 2 organizations that are joining us in opposing this. The Compassionate Caregivers of Maine and the Maine Children for Cannabis Therapy are both opposing question 1 for the various reasons I just mentioned.
Okay, we're going to go to a break. Coming up next, we're going to talk about whether approving question 1 would make it easier or harder for the Maine law enforcement community.
It's not as easy as everyone would make it seem or sound.
That's a police chief from our trip to Colorado. We'll talk about this in just a few minutes.